Have you noticed your teeth looking a little bit longer, having bigger gaps between them, feeling wobbly, or been told by your dentist that you have gum disease? If so, you might have a disease we call periodontitis. When you come in for a checkup, the two main diseases we'll screen you for are dental decay and periodontitis. Both of these are caused by dental plaque, and both can cause little to no symptoms until they become severe.
So without regular checkups, you may not know you have either.
One of the ways we'll screen for periodontitis is by taking measurements underneath the gums around all surfaces of the teeth. Usually when we're doing this, you'll hear us calling out a bunch of numbers. If you've never had this explained to you before, it can be a little bit confusing. Here's what it means.
3, 2. In healthy teeth, the gums attach firmly to the bone and to the tooth, with the exception of the last 1 to 3 millimeters. This is called the sulcus, and it's almost like a pocket, and that is defined as starting at the top of your gums, which you can see in your mouth, right down to the base, just before your bone begins.
When plaque gets left on the tooth for long enough, it can start to spread. Plaque which spreads inside the tooth can cause decay. A plaque which causes gum disease can start to grow underneath the gums. It's around this time you might notice your gums looking red, puffy, inflamed, or even bleeding when you brush. This stage of gum disease is called gingivitis.
As your immune system activates to fight the bacteria that has now grown down into the gum tissue, unfortunately in this process, your gum and your bone gets destroyed. This process is painless but permanent, and once it begins, we will now manage and treat you as a patient with periodontitis.
As bone starts to be lost around the tooth, the base of the sulcus travels with it, creating pockets between the gum and the tooth. These deep pockets create spaces where bacteria can grow beyond the reach of floss or a toothbrush and can only be cleaned out by the dentist. Because bacteria in these pockets can continue to destroy bone if not cleaned, it is important to attend regular checkups to prevent more bone from being lost. When enough bone is lost, the tooth can become wobbly, loose, or even fall out.
When you hear us calling out a bunch of numbers then, what we're actually measuring is the sulcus around the tooth. Again, between 1 to 3 is healthy, so listen out for any numbers that are higher, 4s or 5s. The amount of these pockets and the depth of these pockets give us an idea of the extent and severity of the periodontitis that you're experiencing. We'll also take into account the recession of any gums, as well as any bone loss that we can see on the x-rays.
We'll also factor in your medical history, particularly if you're experiencing anything that may affect hormonal regulation, such as pregnancy or menopause, if you're a smoker, or if you're a diabetic with uncontrolled blood sugar. Any of these can affect the rate at which bone is lost around the teeth.
If we diagnose you as a periodontitis patient and suspect that you're losing bone around your teeth, we'll often ask to bring you back every 3 months as opposed to 6 to ensure that your condition is stabilized and no further bone loss or even tooth loss occurs. If your case is particularly complex, we may refer you to see a gums specialist known as a periodontist. Often, we'll work in conjunction with the periodontist to ensure that your condition is stabilized. So now you know what we're checking when we go around and take all those measurements of your teeth. And now you understand why it's so important that you see us for regular checkups and ensure that your brushing at home is thorough.